All right, it's another Monday. Happy Monday here. Thank you guys for joining me on the call this morning. It is December 20th, Monday, 9:02 a.m. And as we always start off the call, we are here to improve the lives of our community with affordable health care. So thank you for being a part of that mission. We do appreciate that and appreciate all your hard work and knowledge base as you continue to learn how to do this business. Now we have a short week this week, so obviously we have the holiday here on the weekend here. Christmas is coming up. Just a quick housekeeping: we will be closing early on December 23rd, which is Thursday at 1 p.m. We will be closed on Friday, Christmas Eve, and we'll return to work next Monday. So it is a shorter week, but we are here to serve you the best we can, and we'll do the best we can to help you and your clients as we close out the rest of this month. So there is opportunities to find new business for both Medicare and ACA, and we'll talk about that this morning. But before we do that, let's talk about training. It is a light week this week because of the holiday. But as normal, there are a few things I do want to point out to everybody as far as knowledge base is concerned. So the first thing is Tom has been kind enough to add in our HPM Shop 2022 link for the training. This is a self-serve link on YouTube to learn our quote and enroll tool for Medicare Advantage and prescription drug plans, as well as supplements, which are going to be added here in the first quarter of 2022. So if you are unfamiliar with HPM Shop or you haven't used it or you need a refresher, please, this is a great time of year to brush up and learn a new skill because this is the future. So HPM Shop training link is on the training calendar every day at 8 a.m. So all you got to do is open that up and click that YouTube video, and it's a walkthrough on HPM Shop. Now, if you prefer to have a one-on-one training or a coaching session where you're just kind of lost and not really sure, you need a little bit of hand-holding on it, I do know Tom Ryan has volunteered to help those that are looking to jump in and with both feet. So please reach out to him. Everyone should have his contact information. If not, you can call our office and we'll be glad to assist you. We are experiencing an outage with our 844 number. We are investigating that. I did send everybody an email and a text last week with our 407 number just to ensure, but you can reach us on that number until we get the 844 number resolved. So we're working through it, and we'll send out an update once everything's been resolved on that. On the training, there is a broker coffee and chat session for Devoted at 11 a.m. this morning. Again, these are sessions where you can get your questions answered, or if you have something specific that you're working with Devoted on, that's today at 11 a.m. It's geared for Orlando, but anyone can join. Bumping over to Tuesday, tomorrow, same thing. Devoted has an open training session on on Tuesday at 11 a.m. So you can join that as well. And then the only other training that I see on the training calendar this week is on Thursday, and Devoted's doing that coffee and chat session in Jacksonville, and that is at 11:30 on Thursday, December 23rd. So that's the training for the week. Again, it's very, very short just because we do have the holiday season upon us. So it's a great time. I know you guys are either traveling or having family come in and out of town. We appreciate anything that you need help with. We're happy to help with as you gear towards this. So if you get sick of your relatives and you need a break, you got HPM Shop training. You can jump on one of these training sessions to excuse yourself from the madness. That's what, it's there just in case you need it. All right. For ACA business, we are in the middle of open enrollment for ACA. Please remember, any business that you're writing now is actually for February 1st effective. The January 1st effective date was closed on December 15, unless you have an SEP, which would allow an individual to start for 1/1 effective. But if you're choosing AEP to enroll somebody, open enrollment to enroll somebody in an ACA plan, an individual and family plan, then this would be, at this time, you would enroll them for 2/1 effective. It should be automatic on HealthSherpa. So I'm sharing my screen with HealthSherpa right now. We did get some news last week from Oscar. Oscar Health Insurance is back on HealthSherpa. They were able to renegotiate their workings. So Oscar, effective immediately, is now available for enrollment on HealthSherpa. So right back to business there. You don't have to learn their new their enrollment site on their portal system anymore. You can go back to using HealthSherpa if that's what you were using. So congrats to them. I'm glad they worked that out. That was very, very helpful. Okay, switching over to Medicare very quickly, talking about special election periods. We are doing our best to compile all the special election periods across the country. If you're doing business in states other than Florida, there are lots and lots of SEPs. Unfortunately, most recently it's happened from weather-related incidents, and so we're using FEMA as a disaster-related special election period. So if you do bump into somebody that's let's say, for instance, in Kentucky, and they missed the AEP because of the tornadoes there, they missed their opportunity to enroll. They have a special election period. But I did go out and find WellCare. WellCare sent us an email with a link to a webpage on all of their approved SEPs. So go back through your email, and you're going to find this page here. And it's titled Broker Resources, and then underneath it says Special Election Period, FEMA State Declarations. So what WellCare has come up with is, because of all of these moving SEPs across the country, whether it's weather-related or something else, you can look quickly at this website. So I would recommend that you bookmark this website. And this is specific for WellCare, and I'll come back to that in a moment. But you're going to go out to this WellCare website, and you'll see all the special election periods that they are accepting outside of the norm. So if we scroll down, for instance, you'll see these are the FEMA declarations that are accepted by WellCare. And what it has is the state that it's in. So let's say you see Kentucky, it's got the details here. You can click the details to open up. It is in select counties, and it's good until February 28th, okay? So that's just one example. But if you scroll down, you'll see all the state declarations. And so here in Florida, you've got Tropical Fred, and it is on select counties, and this one's good until December 31st. You've got other SEPs available here. You've got a 5-star in California with HealthNet. And then scrolling down, these are expiring within the next 60 days or have expired within the last 60 days. So you can't use these, okay? So don't use these down here. It's kind of confusing, but what you want to look out for is this expired SEPs. Do not use these. You're going to use the ones that are up top here, either under where it lists active SEPs, FEMA, state, and then any other one. So these are all the ones that you can use right now for WellCare. Now, keep in mind one thing here. Just because one carrier accepts an SEP does not mean that all of them accept the SEP. WellCare is making a list of the SEPs that they're currently accepting, but that does not mean that United, for instance, is going to accept that SEP, or Humana, or Aetna. So what you want to do is you want to make sure that, if you're a member, if you're talking to them and, they're interested, or you narrow it down to a specific plan, you want to double check and check back with that particular company to ensure that the SEP is accepted. So although this is a FEMA-related incident or a state declaration that says, yes, you have an SEP, it is up to the carrier to accept that SEP. So that's why I say these are the SEPs that are available for WellCare. Now, we're doing, like I said before, each carrier is different, and they accept different SEPs, and we're going to do our best to compile a list of that for you and kind of put it in one place the best we can. It's a moving target. There's a lot of updates that need to happen. But again, we'll do our best to compile that information. But for now, you've got the WellCare one, and you can always sneak a peek here at what SEPs are available for WellCare. So if somebody calls you today and says, hey, I missed AEP, and I'm in Florida, well, it does look like you have Florida. So you go over down here to Florida, you click the election period, and this will have the details on that specific election period, which is an email that they sent to us. So this is kind of nice. It's just a one-pager here, and you can scroll down and you'll see here's the list of the counties that it was affected. So they have to live in one of those counties in order to access that SEP. So there it is, and it's good until December 31. Okay. It even tells you exactly what to put on the application. So this is really important. Okay. You're going to write severe weather. All right. So that is how you get to those SEPs with WellCare. Thought that was a really cool thing. And so just go back into your email and grab that page, that link, and you can go ahead and save that link, and you have it forever and ever. Amen. All right. In fact, for those of you that are on the call, I will go ahead and punch it right into the chat here so you guys all have it. All right. There it is. So just check your chat here if you're online, and you have a link to that on your for WellCare there. Okay, bouncing over to HealthSun. HealthSun is a brand new health plan that we have contracted for. This plan is available in Miami-Dade, Broward, and Palm Beach County. This is specifically a Medicare Advantage plan designed for South Florida. Well, why did we contract with HealthSun? Why are we bringing this product to your knowledge base? We know that now that you have HPM Shop, you can do business pretty much anywhere in the country. So I'm looking for places where there's 5-star opportunities, and one of them being in South Florida with HealthSun. So this brings about our 6th 5-star plan in our portfolio. So let me list those off again on 5-star, and we're going to talk about 5-star a little bit on this call this morning. So we do have, most of them are in Florida, but we have a 5-star plan with Care Plus, with Cigna, with Optimum, with Baycare, and now with HealthSun, and that's in Florida. And then we also have a 6th one, which is HealthNet, which is a Centene product, a WellCare sister company out in California, in Southern California. So 6 5-star plans available. And so if you have clients move, or if you're wanting to do marketing in those areas, it's a really smart move, because in those areas, open enrollment has not ended. You can continue to write business in an area where those products are available. So we know that for instance, Care Plus is in several areas, including from Jacksonville to Tampa to Miami. So you've got a larger spread there. Same thing with Cigna. Baycare is kind of in that Tampa market only, and then Optimum is pretty much from South Florida up until kind of like central Florida there. So you have to know where these 5-star plans are available, because you can do marketing, and if somebody gets on the line, there you go. You have a 5-star that's going to be available for you year round. So this 5-star, specifically with HealthSun, they have incredible plans, D-SNPs, give back plans, core plans. They've been around for a long time, and they are now part of the Anthem family. So in Anthem, and speaking about Florida specifically, because they're here in Florida, the Anthem brand now owns Freedom, Optimum, Simply, and HealthSun. So those are the Medicare Advantage plans that they operate here in South Florida. So they have 2 5-star plans with Anthem. Now, if you're considering this, hey, Justin, I don't want to do another certification. Well, the good news is if you've already done your Anthem certification, you're already good to go with HealthSun. So that Anthem certification now, if you've done Simply, you're automatically certified for HealthSun. So all you need to do is do the paperwork, the contracting, which you only have to do one time. And then next year, when you recertify for Simply, you will automatically get HealthSun, or vice versa. If you certify for HealthSun, you'll automatically get Simply. So, and those of you that are in New Jersey, you also get AmeriGroup, and that's in New Jersey, Texas, and a couple other places as well, Tennessee. So having AmeriGroup in your pocket, just by doing that certification, you get all 3 of those products in one certification. So that's really, really nice. So it's not much more work to add this product. And, if somebody calls you from Miami-Dade, Broward, or Palm Beach County, and they're like, hey, I missed open enrollment, can you get me set up? And the answer should be yes, because you've got a 5-star plan with HealthSun. So, if you're anticipating that, please go ahead and reach out to us, to Jessica, and we'll get you set up with HealthSun. Doesn't take long. The contracting process has now been digitized, so it should go pretty quickly for you, and we'll get you rolling. So again, HealthSun, 5 stars, an Anthem product in Miami-Dade, Broward, and Palm Beach County. So check that out. So again, just talking about 5-star opportunities, these plans work really, really hard with both the members and also the providers to achieve this 5-star designation. And, it seems like the 5 stars are getting easier and easier, because more and more plans are achieving 5 stars or achieving them more often. And so HealthSun, on their website here, if you could see it, It says HealthSun is proud to be the only Medicare Advantage plan in Florida awarded 5 stars for 5 years in a row. And so they're the most consistent on the 5-star. But this comes with a lot of factors, not just customer service, like what we're normally used to in star designations, but you're talking about medical risk, how the members are accessing care, the availability of the network, the benefits on the plan. There's tons and tons of factors, but it is also affected by you. Yes, you help the 5-star designation by doing those HRA forms, the health risk assessment forms at the end of the applications, by servicing your members, which is a big key part of that. And then also placing your business with quality providers that have star designations. And you should know that the MSOs, the larger groups of doctors, also have to maintain and achieve a star rating as well. And that is dictated by CMS, which then aligns with the health plan. So 5 stars or the star ratings in general are really, really important because we all want to be able to grow our business. We want to make more money. We want to serve more people. And by having 5-star availability, this is the first year that we've had so many 5 stars. So we do anticipate, true organic growth throughout the year outside of AEP. But that comes from you. You have to stay engaged. You have to continue to serve your members, do the right thing for the right reason. You have HPM Shop that'll literally do all the work for you by narrowing down which plan is best for them based on their drugs and their doctors and what benefits they're looking for. And that's really going to go a long way by placing the right person in the right plan for the right reason. And if HealthSun fits, then you've achieved the 5-star member, and that member you can enroll year round, and hopefully they'll send members to you that you can help enroll year round. Just keep in mind that our number one lead source is client referrals, and that's across the entire company. The number one lead source is client referrals. So keep that in mind as you're working with your members. And I know some of you are doing events and you're doing doctors and you're doing your own advertising and things like that. And we get it. But at the end of the day, year after year, month after month, it's always client referrals. So, take advantage of that and also just really, really pay attention to these 5-star plans and what areas they're in. Because there really is, at least in Florida, you can't throw a rock and not have a member in a 5-star territory. So, and then now that we have so many SEPs across the country, really, really pay attention to your SEPs. If you don't have a 5-star in your area that you usually market in, please know your SEPs. And we'll be doing another SEP training outside of this that I'll be recording and sending out to everybody just to give them an update, give you guys an update on what you should be doing at this time. Even though it's a slower time, we can still grow our business. So that's the 5-star designation. Keep that in your back pocket and make sure that you know what you're doing there. All right. Moving on to United Healthcare. We were just talking about, staying in touch with your members, and United Healthcare has sent out an email with updated sales materials and contact information, and that's on their United Healthcare Toolkit. So those of you that are online, when you log into your Jarvis account, you're going to go over to sales and marketing, and it'll take you to this page right here. And you want to go down to your United Healthcare Toolkit. You'll click Launch Toolkit, which is right here, and that will pop out a promo page here, which I've been logged out of, but we'll go ahead and log back in here, and that'll have all those materials that I was just mentioning. United Healthcare, because of the holidays, is really excited to announce that they have, holiday gift or greeting cards. And, those are smaller things that, we might take, for granted, but these particular, touches are really, really important. You might be the only person that sends them a Christmas card or a New Year's card or a birthday card for that matter. And as sad as that is, it is reality. And I've had members long ago that when I was, on the street and I would send these cards out, I would get phone calls to say, hey, you were the only one that sent me a Christmas card this year. And that, it's kind of heartbreaking, but also, I felt good about, making somebody's day. So, not just that, but you have all sorts of different products here. So for those of you that are following me online here, you've got these toolkits for all types of communication. So I do really encourage you to log into this, the toolkit, and they've got all sorts of great stuff for online selling as well. So if you're more familiar or want to be an expert at online selling, this is where you go. All of these materials that you have with United Healthcare here, anything that you find is plug and play. You put in your information. It may even be preloaded. And then from there, you can download it or send it to print. And it's ready for use. It's already been pre-approved. And all you have to do is just plug in your information so you're ready to go. So if you have a slower week this week, many of you are not really seeing clients because of the holidays and travel. So start working on your marketing plan, and this could be part of it. It's not too late to send out a happy holidays card. You can get that done in just a couple of hours. And I believe they even have their own mailing service here. So if you need help with that, you guys know how to reach us. Please make sure that you do. And we're happy to help with that. So that concludes our call. I'm going to keep it short today, somewhat short today. And as always, I really appreciate everyone for being on the call. These calls are being recorded, and we will have these type of calls next Monday, right before the end of the year. So I do appreciate everyone. It looks like Elisa, you have a question?
Yes, I do. Sure. I have a client who I just enrolled for AEP, but he was on he received help, SSI or something like that, but he had some sort of Medicaid. And I switched him over to a WellCare plan, and I'm not showing, or it's not showing in the system, that he has LIS. Have you ever seen that before?
Do you know when he was approved for LIS?
No.
Okay.
He had, he could get medications through Medicaid, but now it doesn't show. When I look in the system, they don't show him receiving LIS.
Okay, so you recently enrolled him and he had Medicaid prior?
Yes.
Okay, so he's
not
new
Medicare. No Medicare. He's just getting on Medicare.
So let me explain what's happening there. And this happens across the state, in Florida, but in other states as well. So what you're describing is someone that's coming off of full Medicaid state benefits, yep, and is now eligible for Medicare for the first time.
Right.
Now, because they did not have Medicare, they had all of their prescription coverage through Medicaid. Okay, yep. So the state was actually covering their medications.
Right.
Right? So what ends up happening is the person has Medicaid, then they get Medicare, and Medicaid has to send up a notification because they're saying, hey, now that you have Medicare, we can't cover your drugs anymore. You have to go under Medicare Part D. And so Medicaid sends that information up to Social Security, and then Social Security then transitions that member into LIS. Now, the LIS status could take 60 days to activate, but it will be retro. So there's no panic there. And I'm saying that as just kind of a CYA because sometimes, it does take a little bit of time for the LIS to start. Because remember, they're turning off their Medicaid prescription benefits and they're turning on the LIS benefits. So it's going from state government over to federal government. Okay. And then once the LIS is turned on, the health plan is notified and then that syncs. But it can take up to 60 days. So just let your member know that transition, it's not in your hands. It's up to the federal government. So that's what happens. But that's why you're not seeing it in the system just yet, especially if this member is starting on Medicare for, let's just say, January 1st. If they're not active with Medicare, they're not active with LIS. LIS will not start until their Medicare starts. That's the very, very earliest that it'll start. But even after their Medicare starts, it could take up to 60 days for the LIS to reflect for the very first time. But any medications that happen, just to have that person hold their receipts because it is retro and they will cover it for them.
Okay.
Yeah.
All right. And in regard to the same issue, I know that the Medicare, or I'm not sure who Medicaid, but they will automatically put them in a Medicare plan, right? When they're eligible for Medicare?
No, they will not
No.
be automatically enrolled in a Medicare Advantage plan. If they do not do anything and their Medicare goes active, they will be automatically enrolled in a Medicare Part D program as soon as their LIS starts.
Oh,
Yeah.
because he said that he was enrolled, somebody enrolled him in I think a Blue Cross Blue Shield, but maybe he didn't recognize the difference that it was a Part D plan. But
Yeah.
anyway, he said he canceled it because he saw that he was going to have to pay for medications. So he canceled it.
That happens because they don't yet know that he has LAS. Well, they do know that he has LAS, but they print out the regular, copays on there because they don't know what level of LAS he has until it actually starts. But what also happens in that situation, and this is not just for Medicaid, but if anyone applies for LAS, and we'll cover this on the next call, but if anyone applies for LAS, if they qualify, Social Security will automatically assign them a Part D prescription program, and it's a round robin. So it's just a random chance because you have all of these different Part D programs out there. And so, WellCare will get one, and then Humana will get one, and then Blue Cross will get one, and then it goes around in a circle like that until everybody gets one, and then it starts over. Okay. And so it's random. So if that's why you're out there, because that's good, because you're educating your member. You're giving the power back to them to choose the plan. And so they're not being chosen, the government's not choosing a plan for them. They do have the right to change because they're in their election period, right? And so, a person that has Medicare and Medicaid, they're definitely going to be better off with a DSNP. But in most circumstances, a member is not automatically enrolled in a Medicare Advantage plan.
Okay, so that's probably what he meant. I mean, he told me Blue Cross Blue Shield, but I guess he really didn't understand that was really the prescription drug plan.
Yeah, it's most likely just the prescription drug plan.
Yeah, and also on the same particular fella, he got a call from Devoted, and he didn't realize that he signed up for Devoted because he speaks Spanish and he didn't understand. And I don't understand how they could have enrolled him because they would have had to ask his permission for the scope and then for the appointment, the application. And he said he didn't realize. So now I got to go and re-enroll him again.
Yeah, I mean, our clients do funny things sometimes. And no offense to them, but sometimes they don't tell us all the truth. And sometimes they forget, I've had members that said, I filled out something in the mail and then I got a phone call and then I was enrolled, and they don't realize how quickly that process happens. I had a member call me and they saw a commercial on TV and it was their health insurance and they called the commercial, but it was a broker call center that was not associated with the actual health plan, and they were enrolled in a different plan within the same company. And so I, obviously lost that member, and they called me and I said, I'm not showing you on my book. And then they experienced a lot of customer service issues, and, we were able to remedy that for them. But yeah, those types of things happen a lot. So that's kind of one of the reasons why I was speaking today about staying in touch with their members, sending them holiday cards, sending them a message on Facebook, sending out a text message, email, whatever it is, because of the very reason you just mentioned, that, maybe your member did something and was kind of a little embarrassed, or, you run into this situation and maybe they lost your number. Maybe they just, until you actually reach out and they're like, I got to call Elisa. Thank you so much for that Christmas card. I got to call you because you reminded me that, something funky's happening here. So,
but anyway, kudos to HPM because they're the ones that caught it to say that, my application was rejected. And that's when I reached out to him. And he did say that it was kind of like, I do remember that now, but that was like a trick call to me. I really didn't understand what was going on.
Yeah. And unfortunately, there are, and even on top of that, there are bad eggs out there that are doing bad things that they shouldn't be doing, like, cold calling. So I'm not to say that didn't happen. But if we do identify those things and your members are willing to, I would recommend that they call CMS and file a complaint for marketing practices, because that's exactly, we're trying to avoid that.
Right. Okay. Well, thanks so much.
Yeah, you're welcome. Thanks for the feedback. That's great. Okay. Any other questions this morning? Fantastic. Well, thanks again, guys. I really appreciate your time and attention. And I wish everyone a Merry Christmas, and we'll see you here on Monday.